Wow. Well, so I'm really glad we have a big bunch. I see there are more. Come on down. There's seats up front here, and the rest of the audience will tell you that I don't bite. Um, Apparently, you didn't believe me, but anyway. So welcome to How to Enhance Journal Club, and I can see from the numbers of you that are here that this is an issue and is a problem. My name is Dan Mayer. I sort of thought up the idea and organized it with Brian Kane. They'll introduce themselves in a little bit. I'm retired. My wife says that we're suffering from OLD, so you'll pardon me for that. I worked at Albany Medical College, where I was a professor of emergency medicine for 27 years. And I'm going to start off by giving a brief historical perspective on my experience with Journal Club, at least in the beginning, and then we'll introduce each other and talk a little bit about ideas for Journal Club that hopefully you can take back to your institutions. I started at Albany Med in 1987. I can see from looking at you that probably about half the audience was not born yet, but that's okay. Don't worry about it. I have grandchildren who might be older than some of you, but anyway, the first experience that I had with Journal Club was at Albany Med. And the way Journal Club worked is that a drug rep would sponsor Journal Club. They'd take us to a nice restaurant and give us a nice meal. And then they'd give a spiel about whatever drug they were pushing. And being a conscientious reader of the medical letter, I always had something to say about what they were saying that usually kind of put what they said into perspective. Okay, yeah, this is a good drug for this, but it's not the best, and these other drugs might even be better and cheaper and have less side effects or whatever. So I kind of did this gadfly thing for a year or two, and then the American Medical Student Association, AMSA, came out with a report card, and I was glad that at least some of the panelists remembered that. They came out with a report card for relations with pharmaceutical companies, and they rated every medical school in the country on this. Albany Med got an F. It turned out most of the F was because we didn't respond to the survey, but when we did respond to the survey, I think our grade went up to D. And the college decided that they better do something about it because it was not good publicity. So they basically told the individual departments that in anything to do with the pharmaceutical representatives that they had to have a balanced presentation. And so the pharmaceutical rep got 5 minutes, I got 5 minutes, and it was a formal part of it until a year or two later, the college said, no more drug reps, we're just gonna stop it all together. So that was sort of the evolution of our journal club. And we then transitioned to a more social journal club at people's houses. And everyone, all the attendings took turns sponsoring journal club. I'm not going to talk about the content because that's what we're all going to talk about in the next hour. So I'm going to pass the mic around and let each of our panelists introduce themselves. Katie?
Hi there, my name's Katie Mays. I'm at Virginia Tech Carilion. I also want to just say, as part of the intro for this, as we were deciding how to organize this talk, we really want it to be iterative, and we have so many people in the room who have different journal clubs and have different ideas, and our whole discussion section is going to be about innovations that you're actually doing at your institutions. But really, at any point in time, as we throw slides up, we're all going to be talking and jumping in, and we hope that you too will also jump in as a part of this panel discussion.
Hi, I'm Steve Hockman. I'm at St. Joseph's Health, Paterson, New Jersey. I've been running our journal club for about 15 years or so, passionate about journal club, happy to be here and happy to hope we can get some ideas really among this group.
Hi, everybody. Martin Wegman. I'm at ASAP as well as down in Florida at Orange Park Medical Center. Hoping to share some insights. I'm primarily a methodologist by training, but hoping to share some insights also on how to bring a journal club to a community program where almost every resident coming to our program is not interested in having anything to do with academia.
Hello, everyone. My name is Kevin Mercier. I am the pharmacist on the panel today. I'm at the University of Texas at Austin College of Pharmacy, and I practice in Houston, Texas.
Welcome. I'm Brian Millman. I'm faculty at UT Southwestern in Dallas, Texas, and I'm looking forward to our conversation.
I'm Kevin McGurk. I'm on the faculty at Medical College of Wisconsin in Milwaukee, and joined this panel in part because of interest in how we can boost resident engagement and enthusiasm in Journal Club.
James Paxton, Wayne State University in Detroit. Doing Journal Club for about 15 years. And also importantly, I like to say this in front of the group, I'm working on a Journal Club primer. So if anyone in this room wants to contribute to that project, please email me, james.paxton@wayne.edu. It is relevant to the talk, so thanks.
And thanks for putting the primer together, James. My name is Brian Kane. I'm a professor at University of South Florida, about to become Jefferson. It's a long story, and we're not going to talk about it here. I've published a couple things on Journal Club, and I'm going to move around the audience like Merv Griffin. So if you have a question, I'll get the mic to you. With that said, I'm handing it back to Dan.
All right. So here's our disclosures. As you see, most of us don't have any. I do. It'll come up later. James and I do, but you can read all about those. Okay. All right. What am I thinking? All right. So the objectives for our session today is basically to give you an understanding of what the pros and cons are of setting up a journal club, and what some of the different formats are, the pros and cons of those different formats, and what are the elements that you ought to be thinking about including in your journal club as part of the discussion. And then what are the options for moving this into post-residency and independent EM practice. I've been, as an aside, I've been bugging my dentist to let me come to his journal club. They meet once a month. And for some reason, he hasn't taken me up on it. Although my other hat right now is teaching evidence-based medicine to dental residents in New York State. All right. There we go. Who's up?
It's me. Okay. So the question here is, why do we do Journal Club? And from my vantage point, I would say there's two main reasons why we do them. The first being just to get the residents to read the literature. And this includes both kind of current papers on whatever the hot topic of the year is, as well as like old classics, things that we read 15, 20 years ago and still guide our practice. The other thing, which is maybe the hidden agenda for us, is to teach them about how to critically appraise the literature, okay, to give them some kind of understanding of standard basic evidence-based medicine concepts, and to get them to understand why we don't just read a paper and incorporate it into our practice before we critically appraise it. Now, I would say, I think the panel would agree with me that there isn't a single resident, or hardly any, that come to an emergency medicine residency with the idea of learning how to, understand EBM. That's not really their focus. And so it really is something that we're kind of trying to, in some ways, go against the grain to teach them. But I will say that over the years, I've got probably about a dozen residents around the country that are actually have been turned on to this and are running their own journal clubs. The third objective, and maybe to some people the primary objective, is to create a social gathering. And so in our shop, we do half of our journal clubs out of conference on a Tuesday night at a restaurant, preferably with alcohol, or I should say always with alcohol. So that's my understanding of sort of like why we do this. Others may have some other thoughts.
Kevin?
All right, I'm just going to shout. So we've included this slide because we also want to be mindful about who Journal Club is for, who our participants are. You know, the old expression, if a tree falls in the forest and there's no one there to hear it, does it make a sound? Well, if you have a journal club but no one reads the articles or attend, do they learn anything? And so we want to be mindful about who our journal club is for, and what our objectives are in hosting that journal club. And with that in mind, we want to be intentional in selecting appropriate journal articles for the people who are attending your journal club. So even just on this panel here, we might be hosting or leading different kinds of journal clubs for different kinds of learners. And that should inform the sort of articles that you're selecting. And we just have some examples up there to kind of summarize what that looks like.
Essentially, knowing your audience is really important here. So being able to tailor from student to resident to fellow faculty is really key. And setting the tone for the purpose of the journal club to develop critical appraisal skills is really key. In the current landscape of AI, anybody can, copy paste a journal club article into ChatGPT, and it'll spit out all kinds of things about like what you should think about the article, what you can critically appraise. But the product of journal club is to really develop critical thinkers and practitioners who can evaluate the literature rather than just put a prompt into a AI generated thing and have it spit out what you should know about it.
I just want to add that as a room of EM educators, we should always be thinking about the pipeline to emergency medicine, how we can involve medical students. And as Journal Club is often a social gathering at many of our institutions, getting medical students involved in whatever capacity we can, this is a fantastic way to show them emergency medicine, not just EM interested medical students, but all even preclinical medical students. It highlights our understanding of evidence-based medicine in the literature, but it also gets medical students in an environment outside the classroom or outside the ED with residents and with attendings.
Similarly, we also hear a lot about interdepartmental relations, especially as people are on the trail. They're so interested in how does your emergency department relate to your surgical colleagues and so on. I think Journal Club is a really unique opportunity to invite cross specialties because it's a social gathering and because it's informal, being able to talk with those people in a different light and talk about particularly an issue that affects maybe both of your departments in a tangible way, I think is a really unique opportunity.
All right. Brian?
Yeah, so in our program, we actually have a regularly recurring 12-month curricula. So the goal is over 12 months to take our junior residents, we have a PGY 1 through 4 training model at our shop, and give them basic EBM skills. So every year in July, we teach them the concept of a PICO question. Why is that? Because in August, we teach them the hierarchy of evidence, so that they understand. In September, we actually do structured searching, so they understand how to use Boolean operators and mesh terms. October is external validity. November, we teach them Bayesian logic, so we'll talk about 2x2 grids. In December, we acknowledge that a lot of the reading you're going to do on shift is not the article, it's an abstract. So we review the abstracts from ASAP, and we have a kind of a social fun competition trying to locate the abstract that you could use clinically. So there's got to be clinical significance to it, but with the lowest number needed to treat. So the residents really understand that concept. With the switch of the calendar year, January on, we start to introduce to the junior residents the concepts of critical appraisal. And we use as prototypes an article on diagnostics in January and then on therapeutics in February. In March, we recognize that there's no point of having Journal Club if you can't bring it to the bedside. So we have a special focus on communication, critically looking at shared decision making. In May, our EBM residents pick a wildcard topic. We'll sometimes do things like peer review. And then in June, again, we wrap up the year trying to do a little less work with a review of abstracts from SAEM. And here the competition is around a clinically significant and the narrowest possible confidence interval. So again, we're working on that stat. The curricula is based in large part on the work that was done by Ramos et al. That you see up here. They developed the Fresno test of evidence-based medicine. Our PGY2s take that at the midpoint in their residency, and then the 3s and 4s, having graduated to senior journal club, they don't have to do a lot of the flipped classroom work. They will only come to journal club prepared with their appraisal documentation. So the 3rd and 4th year is, as you heard the panel already talk about, heavy on appraisal so that when you leave, you can be a lifelong learner.
Yeah, I think ultimately, when we look at this organized curriculum that is Journal Club, and especially as ACGME guidance changes about what it means to be EBM educated as a resident, really we want people who are going to leave this place and be able to review articles and determine whether they should follow whatever conclusion that the paper authors come to. And so as we were, discussing the point of Journal Club, really gearing it towards that and maybe using this as a unique opportunity to harken back to your EBM curriculum as it is being developed in the rest of your conference content, and being able to use this to reiterate those topics that are coming up each month.
So the second half of this slide is about picking studies. The curricula I just went through and review, we have resources, and I think it's the next slide. We're happy to give away everything we've done. The curricula I just described was published in WestGem, and I think it's on the next slide. But we actually, I'll work with our EBM track residents to pick an article with intent that it will highlight that EBM core concept. So again, when we do an external validity in typically in October, I'm picking an article where when we do the appraisal, that'll be a key part of the discussion of that article is external validity. In November, when we're doing Bayesian logic, it's got to be an article with 2x2 grids to help illuminate that topic. So you can see here on this content slide, there's a lot of ways to pick this. Based on our resident SWOT analysis this past year, we took the second hour. We have 2 hours of Journal Club every calendar month, and we focused on the 52 articles, and I believe that's on one of the resources. But I've been talking too much, so I'm going to turn the mic off and let the rest of the panel talk.
Sure. Thanks. Yeah, that's great. No, great segue. Thank you. So as far as the content goes, I guess one of the challenges that you'll face in establishing a journal club is selecting the articles, right? Because you want to get articles that have a good mix of what you're looking for. You want to teach certain things. You want it to be interesting and relevant to your practice and so on. And I think there's different ways of selecting articles for your journal club. And there may be reasons to pick certain types of articles. And by type, I don't mean the subject matter or what they were studying. I'm thinking more about in terms of these categories of things. So practice-changing articles that you think are highly relevant, will have a large impact in their clinical practice. And again, we mentioned before that these type of articles may lend themselves to more appraisal. And maybe something that you want to incorporate into your department that you're planning to change. This is in juxtaposition to landmark articles, and I think Dan mentioned earlier that we all have these articles in our folder somewhere that we read 10 years ago, and we still go back to them. And these are landmark things that really have probably defined how our practice is done every day and can reflect in many cases how our specialty has evolved over the decades. And I think those can have they can provide a historical perspective to the residents who are, again, new to this thing called emergency medicine. And they may be very fascinated and learn a lot from an article that is really a landmark article that may have contextual bits in it that are outdated, but will show them something important about why they practice the way they do and why others do. The third category would be like the flavor of the week type of topic, right? So what are all the bloggers talking about? What are all the podcasts about? And I think the point with that is that probably is going to be more engaging to the learners because they've heard about it somewhere else, and it may not be new, but they may be willing to learn more about it. And it's important to state here that we're not advocating that you would just do one type of content, for your entire journal club. The point is that you can select for different reasons, and you can incorporate all of these different types into your journal club. And it can be intentional. You can make an intentional decision about what type of articles to include. So that would be the point I would make here.
Anybody else?
I think this is a good first opportunity to open it up to y'all and hear how you're deciding on the mix of these three things. Just get a couple comments.
It's early in the hour, so our expectations are much lower.
I think the morning caffeine maybe win.
Ultrasound crew sends me 5 ultrasound articles with like 20 patients each, and everybody's like, yeah, great. So we can do ultrasound at XYZ place, but we don't have the same facilities. And my community guys are like, I'm not coming to that because I don't do transvaginal ultrasound in someone's mouth or, all this random stuff, So, I mean, no offense. I want to hear more how you guys get it successful and get people to want to buy in and don't just come droning that journal club like, oh, I have to go to a journal club. It's that they want to go to a journal club. And we geek out about this stuff because we're all interested in this, but the rank and file is not like that. So I need this. Like, I mean, I have ideas, but they didn't work. That's why I'm here.
All right, good. Thank you.
I've got a question. We have a quite well-working journal club. I'm from Berlin in Germany, but we have really a problem getting nursing staff involved. So we have a day where we do together like simulation and all that stuff, and we started a journal club, and we always try to ask them whether they might also work on a publication or something like that, and they are not interested at all. They say it doesn't fit in their time. Do you get nursing staff involved?
It's a good question as to how we can incorporate the other people on the team in journal clubs.
I think an important component that actually both of these questions address is what you're proposing to discuss in the journal club relevant to the people who are there, right? So the transvaginal oral ultrasound and the nursing topics that may not be the same as what the physicians and other people are looking for. I think this kind of fits into some, maybe a little bit into the practice changing content, but certainly into the current events and relevancy. So maybe one way to do this, and something that we do a lot of, is we have the learners select the topics. And I think that's challenging because you have to give them enough guidance that they pick an article that's good, so to speak. But if you team them up with a mentor, someone who knows about Journal Club and knows what a good article looks like, and have them kind of collaborate together to come up with a topic that's relevant and interesting to what was probably the rest of the learners, at least it gives you a better chance of picking something that someone there is going to be engaged by, versus just picking something that you're personally interested in and then hoping other people want to pay attention to the discussion. So.
Yeah, and I think the issue you're raising, which is something that actually all of us face, is the issue of buy-in, right? Buy-in from your faculty, buy-in from the residents. Buy-in from nursing is a to me, it's a little bit of a distant goal. It'd be nice if they don't come. It is what it is. But one thing that we try to do is, like, every month we've got like the core curriculum Tintinelli topics that the residents are going to be reading about. What we'll do is we'll try to layer in that journal club with relevant articles in that particular area. So while they're reading Tintinality, they might be reading, Nexus article from, 20 years ago, or they might be reading something new, in the literature in that particular area. And we also layer in our SIM. So SIM every month is also layered in on the core content. So it all kind of like feeds in together. Having said that, do all of the residents buy into it? Not necessarily. But, we just try to juice it up as much as we can to create interest.
I haven't been to many journal clubs with nurses. However, I think that one thing that you could do would be to ensure that you're paying attention to like practices for nursing in your department, and making sure that you're taking note of any sort of like pain points. Like, there's procedures that they don't know why they're doing, or they don't enjoy, or if there's medications that they don't understand, making sure to tailor it to them so that they can understand, like, well, actually this literature that was published is kind of like why we do what we do, and things like that. And I think that could help engage them.
Yeah, also, for the last, I'm sorry, give me a second. For the last couple of years, I've been a peer reviewer for the Journal of Emergency Nursing, which I strongly recommend any of you that are interested in doing that, get in touch with them. But have the nurses pick papers from their literature, from the Journal of Emergency Nursing and other nursing journals. And the same thing goes for EMS people, pre-hospital care providers. Have them pick some papers from their journals and use those in Journal Club, so that you can have your residents interact with them on that level. I hope that helps some. Yeah.
Okay, I would like if any of you could share your experience in your journal club, what make it cool, and how that can have impact already on your regular practice and your residents, please.
Is that the Holy Grail question?
I think we get to this.
We have a slide.
We'll come back to that in a few slides. Go ahead.
So this slide, and you all have access to our slide deck somewhere in the.
So to the original question, how do you select articles? These are resources. Everyone can download them that the group here put together. The Classics Articles resource you see there was put together by a group at Einstein, a group at SAEM that I was involved with put edition 2 together, but this is the newest edition. When you take a look at some of the websites, and I'm agnostic, there are a ton out there, but these are 2 that I tend to use to pick articles, because then when we review them, it's not I say, this is how you appraise it, this is how external experts. I'm old enough to remember that an expert used to be defined as someone from out of town that brought their own slides. So that's what that hits. And then Evidence Alerts is a way to create a community of practice. So it's a free source. It's put out by McMaster's University. You can sign up for it. And when you sign up for it, you put your interest threshold. I have mine at 6 and 6. I define my specialty as emergency medicine. We take care of everyone. That'll give me an article a week that's fairly high-level methodology. For students, for learners, the great thing about that is you can change your specialty as many times as you want. So a third-year clerk, this is an amazing resource, because they can claim to be interested in peds 1 month, psychiatry the next month, and when you log into this under your profile, it's got 2 wonderful hidden things up at the top. It'll say article list, and under that, there's 2 drop-downs. One is, in the last 365 days, what are the highest rated articles in your specialty profile? Not says me, not says this panel, says McMaster's, where they invented EBM. So I will use that oftentimes to pick articles, because I know there's a lot of meat on the bone for me to teach. The other is, what is the most commonly read articles by people with shared profiles? That's what the cool kids are reading. I've never been one of them. If someone could teach me that, I'll meet you in the back afterwards. But every once in a while, I'll pick an article that the cool kids are reading to do what James talked about, so we have that great selection. So for each of our sections, we have resources we've accumulated for you. And Dan, I think we're going to move on to the next section.
Kevin and Kevin.
Oh yeah, sure. So this actually probably speaks a little to the question of how do you make journal club cool, to maybe give too much credit to what I am doing. I am one of several rotating faculty who will take 1 journal club per year. And for the last few years, what we've employed is what I call journal court. Instead of kind of the conventional structure of taking an article or 2 and being methodologic about how we think about it and appraise it, we take 2 separate articles that reach competing conclusions about some clinical topic. I draft a fictional medical case. And the residents who would otherwise be presenting those articles, instead of just presenting the articles, they use the article as their expert testimony in a fictional medical malpractice case. We'll impanel jurors. It'll be the residents. The residents will speak their piece. We'll render a verdict. And then at the conclusion, we'll do a little bit more of a conventional journal club breakdown of the articles. We have found it to be maybe a little bit more novel and engaging for the residents, and at least anecdotally, it seems to really boost their engagement.
So next on interprofessionalism and participation in journal clubs, I think that involving different disciplines and inviting different disciplines into your journal clubs can really add to the quality of your journal clubs, just because other professions and other disciplines can really look at the same kind of article that you're reading, but through a different lens, through their own training and education. For example, as a pharmacist, what I would obviously be most familiar with is like the drug literature, and oftentimes we're looked to during these kinds of journal club activities to kind of provide commentary and lead discussion on these. And so I think that similar to your question on how to get nursing involved, that when you find a group of physicians bring an article on a drug treatment, for example, and they may say like this is why we do what we do in our emergency department. If you were to invite emergency medicine pharmacists or nurses or whoever, they could also bring articles that you're maybe not very familiar with or you've not seen, or may explain it in a different way, and can kind of build your armamentarium for journal clubs that you can have in your file. I think you had something to add on this, did you?
I was just going to make a quick comment about so the journal court is really a cool idea, and we actually when I took over Journal Club about 3-4 years ago, started a kind of a debate like format. It's similar. It shares a lot of similarities, maybe not quite as quite as much in terms of the mechanics, but I would definitely encourage you to kind of think towards one of these two approaches. I think they are very engaging. Usually we assign 2 residents to kind of be the leads. They each have competing articles on a particular topic that is very relevant to them, that they usually select themselves, on a clinical case that they have built out themselves that has a clinical question that needs to be answered using the literature. And so they'll have these competing articles that will be approved by faculty, and we'll have a kind of a structured debate-like format where they are required to present on things like validities and things. They can't just kind of critique the other for kind of nonsense. They have to focus on scientific validities. They have to focus on certain aspects of things. But in the end, I think it draws in the audience. They're a very competitive bunch, and the audience is wanting to kind of side with one another. We also incorporate a vote component to it too, so everybody has to kind of align with a particular stance right before it starts, and then at the end has to vote for who convinced them versus not. So I think that gets more allegiance as well. So, and then I think kind of towards this point too, we've talked about selection of topic. We've talked about that the mechanics of the actual session a little bit. But I think also just setting a culture that's very supportive of VBM is important. So that goes to your chair, your PD, and being at a community shop, it can be very easy for our faculty and chair and everybody to kind of poo-poo EBM and kind of say deprecatory things around that topic. And it still happens at very academic places too, like, who we'll see if the residents actually read read the paper or something, and that culture can kind of sink your club. And so if you have PD and other faculty who you can kind of get on the same page and are very passionate about it, I think that inspires the residents as well. So those are just some other points I want to make.
So the reference that's there, that is the article with the curricula I described earlier. And what we do in our shop is EBM is a procedure, no different than a central line or an airway. And the residents do EBM activity on shift, and then they get feedback on it. So that's, to Martin's point, how we've created that culture. We treat it like this is fundamental to being an emergency physician. You want to intubate, you want to get access, and you want to be a lifelong learner.
So,
Sorry.
So somebody had mentioned earlier that some of you have journal clubs at like venues, restaurants, whatnot. I took over journal club for my group a year ago, and the biggest thing that I found to be a headache is taking over journal club also involves booking the venue. And I was just wondering like what the experience of you guys are, is whether that's common, or do you guys have secretarial help with that?
that is a great segue into our next point on kind of how to make it cool and how to make it a social gathering. I think we all know that we spend a lot of time in the didactic format, and part of making Journal Club something that's accessible and something that's different, I think, revolves around making it a social gathering. How we do that and how we make it cool, I think, is food and drink. Alcohol makes everything cooler, right? But ultimately, too, I think this is a time to see people outside of a classroom setting and to really paint faculty and colleagues in a different light. It's a good question. I think I have been at places that have done Journal Club at a venue, and yes, historically, at least for us, that was a residency-led journal club, or resident-led journal club, and the residents would book the venue. We also have had it at faculty homes, and I think I would love to hear from the group. I would say that has the most engagement, in that people feel really strongly that it's a good experience, but our turnout is never nearly as good as when it's convenient. And I think what has been the default, at least in the two places where I have been involved the most with Journal Club, is having it after a conference session somewhere with food that's immediately following, because that usually tends to get the best participation. There are a lot of people, even in our panel, who have Journal Club as a part of their actual formal conference time. And I think that obviously increases participation too, but everything comes with pros and cons. Would love to hear from the group or the panel on kind of any best practice tips that they've found at their places.
One of the things that we used to do was that we'd have either the Journal Club would be at one of the faculties, one of the attendings' homes, and the department would pay for it to be catered. Or at a restaurant that would be sponsored by employers who were looking to get our residents to sign on with them. They might be a really good source of the venue and the food for journal clubs, and give the residents also an opportunity to find out what the working conditions are in those other places. And these would be hospitals around the area. Some of the big groups used to do that. So
one approach that we use is I have the resident make the reservation, so it takes it off your plate. I don't know if you can trust someone to do that for you, but it may be an alternative solution rather than you have to do it yourself.
I think the the biggest thing actually is getting sponsors. So often it's practice groups. In some cases, we've had like instrument companies that manufacture stuff. And generally, if you can get a sponsor, they'll set up the venue. But in the absence of that, what we've had in the past is like a social chair, a resident that's their position. So they set up journal clubs as well as other type activities during the year.
Hi, everyone. I'm a resident. I don't want this to sound sophomoric. Because I've never hosted a journal club, but I want to push back on the idea that journal club has to be like fun or cool or with alcohol. I especially want to push back on the idea that the resident should be booking a venue. But I really think what journal club needs to be is useful. We show up to these things and it's exciting to see our friends and it's exciting to be at our faculty's houses, but I leave there and I'm like, great, box checked. What does this actually do for me reassuring a patient that they can go home with their indeterminate troponin? I think what we've kind of touched on a couple times about starting with, here's how to take this to the bedside, here's how to use this in your everyday practice. I think if that was the first journal club that we went to in the beginning of intern year or MS4 year, when you're kind of in that undifferentiated phase where you're really trying to be eager and impress, like that I think is the time to catch people and make this kind of an engaging thing. And I don't think it has to be like 1980s MTV. Like it can just be like, we all want to learn. I think we can just like really make it very, very useful.
Hi, I'm one of the PGY3s at Mass General Brigham, and this past year I was also one of the resident journal club leads, and I feel similarly like we're constantly working on this balance of like trying to engage residents, although we're very much a resident-run journal club, actually getting more faculty buy-in, and like how do we get faculty to want to help mentor and like pick the right topics or host journal clubs or really distill everything down to like what is most useful, because I think in the end that is why the residents are like taking on this extra time out of their day or training program to like be there and learn from the faculty and the experts.
Supposed to walk the microphone over. We've tried it both ways at our shop, and the single journal club lead seems to have a more cohesive experience to the bringing it to the bedside than this month is ultrasound, and there's an ultrasound focus about why ultrasound's great. This month is tox, so that's why tox is great. I'm wondering this way because there were like two hands. Yeah.
I'm a PGY3 who was a journal club lead last year at UNC, and this year one of the chief academic residents, but still have my hand in journal club. To kind of piggyback off that point of like, how do we make journal club relevant? We've realized that like one thing that's helpful is like you make a short summary sheet for sure, but then having some type of clinical deliverable that's also not a lot for we have resident presenters do. So for example, we reviewed the ACEP clinical guidelines on tetracaine for non-complicated corneal abrasions. And one of the things they have in there is like, when you send patients home, here's the stuff that you should like put in their AVS equivalent. And so we actually modified it for our university. We had the resident modify it for our university, make it a dot phrase and send out via email. It's like, hey, here's your kind of deliverable from this. In these situations, it's okay to use this. And here's a dot phrase you can plug in right there. So that way it makes it take home. Same thing for lidocaine for shoulder reductions, lidocaine injections, like making a video of how you would do that. So that way when you're on shift, you're like, oh, we did this in Journal Club. Here's a reference. It doesn't work for everything, but I think that's how we have found a lot of like people talking about Journal Club after Journal Club, which I think is like, that's the proxy of our main goal.
One of the panelists earlier talked about partnering with your chair and stuff. If you do some implementation science reading, that follow through, because you read an article about a key strategic departmental initiative, keeps the talk going.
Just kind of dovetailing on some of the comments we just heard, I think part of what makes residents or whoever's attending engaged with Journal Club and makes it fun is having the skills to like be able to critically appraise that. And I know you briefly mentioned the like PGY 1 through 4 curriculum. I'm wondering if you have resources on creating the actual curriculum to teach, to start off to teach, and that do you do that asynchronously, or do you ever incorporate it into like first Journal Club of the year? Interested to hear how you've approached that.
I apologize, I'm talking, but Dan, if you go back a slide, one more. That article has the whole curriculum, all of the teaching articles embedded in it. Yep. Sorry, Dan.
And the slides are available on the SAEM site. You can pull them up without having to take a picture of them.
I just have two comments. One, I think as Journal Club leaders, like I led Journal Club for 10 years, I think early in that tenure, I felt like if faculty didn't show up, if there wasn't enough engagement, that it was like a personal failure because I didn't make it interesting enough and I wasn't being cool enough. I think just trying to let go of some of that is important and like lean in. If people don't want to be there, lean into that and make the people who are there feel like you are really like engaged with them. You are really focused on those people that did show up so that they're going out and saying, wow, that was really cool. That was really great. Not that it was cool in terms of like the best restaurant or the best food or whatever, but like lean in a little bit. And that's kind of what I learned over the years is like, it's not a personal failure. Journal Club is kind of nerdy and it's not a cool procedure, but it is really important. And so leaning into the people that are there so that they can actually take away the most that is possible. The second thing is over the years, one thing that worked really well is we had the Journal Clubs at faculty homes, and we actually invited everyone's families. So it was actually a come for dinner, come for family hangout time, and then, oh, by the way, we're gonna be learning some Journal Club stuff. So like make it, if you have a hard time feeling like everyone is pulled in different directions, nobody has time, nobody wants to like take that one extra night away from their family, make it so that the kids can come, the kids all go play, like whoever wants to come from, their spouse, their significant other, they're always welcome, and make it more of like a family environment so that you have that time to bond. But then, oh, by the way, we're gonna sneak in some Journal Club, at the end. So that's a way to, if you're more of like a community setting where you're not all academicians and you don't all like get into the nitty gritty of the articles, I think having it more be like we come for the dinner and the social, we'll stay for the Journal Club.
Not to continue to harp on the purpose of interprofessionalism in your journal clubs, but a lot of the comments that we just got were on like how to make your journal club useful, how to continue to have people talk about your journal club after journal club, and the kind of the takeaways from that, and really including some of your other disciplines that touch the emergency department, like your nurses and your pharmacists can increase the usefulness of your journal club. For example, like you were talking about how to make this actually something that you can take away and take to the bedside. Your pharmacist and your nurses are going to be great at applying what you've learned in journal club to the bedside. We know the formulary and like, oh, can we actually order this medication and get it to the patient? those kinds of things. We've talked a little bit about journal court and things like that up here. I think if you're intimidated by that idea, one of the easiest ways to start doing this would be pick 2 drugs for the same indication, assign 2 to either residents or 1 to a resident and 1 to a pharmacist. You're going to be PCC. You're going to be indexinate alpha for head bleeds. You're going to be benzos. You're going to be phenobarb for alcohol withdrawal, and having them debate on the available literature and kind of come to a conclusion could be a really worthwhile pursuit.
And just one more point on to sort of build off your question, residents want to learn, is I think this is a point in favor of collaboration when it comes to selecting articles. Faculty want to choose articles because we're trying to achieve certain objectives, stuff that we've talked about, but residents or students, whoever's attending, well, they want to learn stuff that they care about, and trying to find where those 2 things overlap and select articles that we can use to instruct, but that also are about things that the learners care about and are invested in, can inform their practice, I think helps buy in too.
So article appraisal is always, it's always thought of as being the most difficult part here. And what we try and do was to point out what the validity is of the study that we're evaluating in Journal Club. And then how can we generalize that, or can we generalize that to our patients?
Yeah, absolutely. So my biggest recommendation here would be to use a tool and use kind of the same tool for the same type of study. The risk of bias tool 2 is the one that's most often used in Cochrane systematic reviews. So I would use that for an RCT evaluation if that's your primary study. If you're going to use observational study, Robbins I for interventional, or Robbins E for exposure. If you just search risk of bias tools, these will all come up. They're all freely available. I would use those tools for causal inference studies that are being evaluated. If you're evaluating a prognostic or diagnostic study, Quadus 2 is generally for diagnostic studies, but similar methodology. I would use Quadus 2 every time you're doing a evaluation of a diagnostic study, so that the residents have been exposed to using these tools repeatedly for years, and so that when they leave, they're kind of familiar with the concepts in them. Just kind of a side note there, I've sometimes heard people talk about equator guidelines as evaluative guidelines or appraisal guidelines. They're reporting guidelines, so they suggest what should be included in a paper so that then one can apply kind of an appraisal tool to evaluate for validity. So I wouldn't use an equator guideline such as Consort or Strobe to evaluate a paper. I would rather use one of these structured tools.
So I think one kind of theme that we have is your content matters less. It's really important we pick content that's very valid and important for the residents or whoever you're engaging with. But really, any content, you can use those articles to understand methodology and kind of the hierarchy of evidence. And the question that every journal club should answer is, does this journal format and do these methods really match the question that is being asked? And so I think this is a good thing to kind of come to each time in each session that your journal club gets together. Do the methods match the question? And really incorporating this idea into the evidence-based medicine curriculum, always kind of hearkening back to the hierarchy of evidence and sort of where this falls.
Most of us, I think most of you have had, in fact, probably all of you have had some kind of an evidence-based medicine course in your medical school training, at least those of you that are young enough. And the rest of us learned it on our own. But basically, I'll just share an experience that I've had with the dental residents where they will pick papers that are on the top of the pyramid. They'll pick systematic reviews without thinking about whether the papers that the systematic review is based on are really well done and that they can really rely on the assessment of bias of those papers. So I think this is one of those potential pitfalls that you have to be careful about. If you let the residents only select papers, they will tend to gravitate towards the top of the methodology pyramid to pick their papers. Here are a couple of resources that are available for appraisal, and that we, again, will they'll be available on the slides, so you can incorporate those into your journal clubs. And I think we're out of time. Almost. We have a minute.
Any final burning questions from the audience that the panel can help with? Yeah.
So overall, would you guys say it's better that we give the choice to the residents to choose their own articles, or will you guys take the choice away from them? Because what I'm doing right now is trying to match kind of like what I'm trying to teach them each month with the monthly topic that they are studying, toxicology or whatever, and then giving them like 3 or 4 articles, and he's like, here, choose one of these. In the past, I used to do kind of like, oh, I feel like you're more like, your personality goes with this article, so I'm gonna give you this. That didn't go well. But I just want to get some ideas.
I mean, I would say, as much as they're willing to do to scope out articles on a particular topic, that's great. I would generally kind of reserve the right to kind of say, this one's better. Let's maybe do this one and work it out with them. But as much as you can engage the learners in picking the papers themselves, I think that's great, with guidance.
Timing, like as far as like evening, weekend, what you guys found a particular sweet spot that works really good? Tuesdays, Thursdays,
Weekends are probably bad.
Yeah.
Probably not weekends. Most people gravitate away from that. But like evening events, especially if it's at someone's home, my program does a mix of during grand rounds. So we'll alternate between 1 month, we'll do it during grand rounds, which is in the afternoon or morning. And then the next month it'll be in the evening. And often that's in a faculty member's home. So I think it probably depends on who the host is and what your group would prefer to do, where they prefer to do it at. I mean, it's not very hard in Metro Detroit. It's probably 10 miles or something on average. People are dispersed all over, so you can't really find one place to go.
We do the evening before our conference and grand rounds, so we know they'll be protected in the morning. And it's on the week of the month that our invited grand round speakers are there. So we invite them to Journal Club the previous night also to get some outside.
I'd also like to add a comment. Sorry, I didn't mean to interrupt you. I think it's really important to try to make sure that your journal club is aligned with the departmental mission and your leadership of your department. And one of the questions earlier was how do you get faculty to show up to these events? And what my department does is we actually have a financial incentive, so you get like points for hosting a journal club. And if you can pull that off, it's great because that's a financial, everyone responds to money. Financial incentive for faculty to get involved or more involved. And as far as how you get other faculty that aren't the hosts involved, I mean, probably just developing a culture where it's appreciated and values that they're there, and finding a way for the residents and or the person coordinating the event to show their appreciation to those faculty, either at the event or after or before the event.
We are unfortunately at time. I know there may be other comments. I'm sure the panelists would love to chat with people either up front in the hall. Thank you for attending the session. It wouldn't have happened without Dan. Thanks, Dan.
Yeah.
Thank you, Brian.